Disclaimer, this show is for educational purposes only and is not an alternative for clinical counseling. Please seek a mental health professional for your specific...
Welcome to Intake Talk Show, where it is time to shine the light from a mental health perspective. Here at Intake, we talk about everything life, and we love what we do. We love bringing awareness to various conversations that people often don't have. If this is the first time that you have visited this particular channel and you like what you see and hear, I welcome you to subscribe, to follow, to share, because again, we're going to be having various topics. Look over the older topics, some of the previous topics that we've done, and see what you like. But today, we're going to stick with today. Today is part 2 of our conversation with Mr. Shane Quinn in Ireland. And we are talking about trauma. We are also talking about how mental health is viewed and treated in Ireland versus the States. I'm sure you want to hear this conversation that I have with him. I've learned so much in having this conversation with him, and I'm continuing to learn. Even though I am a therapist here in the States, I'm continuing to learn more and more just in this space with talking to professionals and individuals about various topics. I want you to stay right there. Don't go anywhere. Hit that like and subscribe button, by the way. And we're going to start the show right now.
Welcome back to Intake Talk Show with your host, Bertha F. Barrett, licensed mental health counselor. Today's guest is Shane Quinn from Waterford, Ireland. Join us for part 2 of our conversation on trauma. Your Intake podcast starts now.
Welcome back to Intake. I'm your host, Bertha Barrett. And today I have with me again, Mr. Shane Quinn. And Shane is in Ireland, and we're having such a delightful conversation around trauma, culture, and all of the dynamics around the sense of self and how these things affect us. So, Shane, what I want to ask you is, can you help us understand why trauma is often misunderstood, specifically in families and spiritual communities?
I think typically, I actually read a book which had a really good example of this. I think it was about a month or two ago at this point. I think it's typically because of people's responses to trauma, right? And culturally, I think we had brought it up recently, right? Where culture can shape responses to different things. And I just think people's responses to it differ based on their cultural upbringing. Responses to trauma differs based on people's upbringing and all the rest of it. So I just had read the book Good Morning Monster from Catherine Gildner. Have you heard of this book, read this book?
I've heard of the book, haven't read it yet.
It's fantastic. It really is. But she basically dives into different cases that she considers to be kind of like heroes, psychological heroes, I think was the term she'd used, something like that. And one of the cases she had used was a guy, Danny, who was Cree and from somewhere in Canada. And basically, he didn't speak much, was the idea behind this. And that was a big challenge for her. She is a white Catholic Canadian therapist. Her education is largely, based on European or American psychology, which has predominantly been white psychologists, right? So she has a very set understanding of what she needs to do to help a client get over therapy, help a patient get over trauma, I should say, right? And what was really interesting was, his response was not something that she was used to. He didn't speak at all. He didn't participate at all. He would sit in silence. He would make kind of snide remarks. He didn't show too much emotion. And she consulted a spiritual, a Cree spiritual healer, essentially, who I think had been a pretty high up academic by all accounts. And I think he might have even been a psychologist, a doctor as well. And his exact words, which was really powerful, right, was, you can't make a Cree man a white man. You're trying to turn him right? The treatment was very much that's what you're trying to do. You're talking to him like a white man, right? And so there's an example of she misunderstood his response and had to take it a completely different direction. And if you read the book and everything, she even, whatever about her techniques changing, because she can't change her personality, she is who she
Right.
is, but she took the treatment in slightly different kind of her emphasis shifted. What she wanted him to do completely changed because of that. And I thought it was such a good lesson, whatever about therapists reading that book who are working with people who are different from them. But I
Hmm.
just thought it was a really good lesson in terms of kind of perhaps we judge people a little quickly based on their responses. And sometimes I understand that's necessary, right?
Hmm.
And sometimes it's a reaction and all the rest of it. But maybe let's kind of really do some digging ourselves into why they're responding to trauma in a specific way they do,
Right.
and why does it differ from the way you think you would respond to that
Right.
trauma? Why does it differ from how you think they should respond to that?
Hmm.
You know what I mean? Is it just poor decision making, like we said earlier, or is there a cultural piece, or is there an upbringing piece, or something
Hmm.
along those lines that you have to consider? You know, so there, I think that's probably responses to trauma. I think is a big lead to misunderstanding sometimes, especially in kind of spiritual communities or within a family.
Right. Right. This is why I do believe it's so important for therapists to create a culture around these things in teaching,
Hmm.
in spiritual places, families, bringing these sectors together and educating people. Because often they don't know what it looks like, what it means. They don't understand that everybody responds differently. And while spirituality has been scientifically proven that it does help people, right?
100%.
Significantly, with trauma and different other things. With some people, however, specifically with complex trauma, oftentimes that's not the case. While there is a faith base around coping and they have that support network and believing in a higher being, sometimes it's still difficult for people to navigate the experience around that traumatic event. And so just helping communities like that understand, trauma, what it looks like, and knowing that it's okay to talk about without the shame and without the judgment is key.
100%. Yep.
Yeah, I
Agreed.
love that. Okay. So let's talk about Ireland.
Cool.
Okay. What do you feel is the cultural norm around therapy and mental health care?
In Ireland, it
Mm-hmm.
is I would consider it to be very new.
Mm-hmm.
Like it is, I know, in a lot of different places. I know living in the US, I would have a lot of similar conversations where
Mm-hmm.
people would say it's destigmatized, it's this, it's that, it's more
Mm-hmm.
accepting, and that's great. I really do think it's new in Ireland. I think it's newer in Ireland than it is, more new in Ireland than it is in the US. I'll give you an example. I left high school, you would call it, right, in
Mm-hmm.
2011, and I went to a big school for my area, right? It was 1100. It was a all boys school, right? 1100 boys. We didn't have a school counselor. There was nothing, nothing. There was a teacher who part time did a little bit of guidance counseling, but it was literally just, where are you going to college? That was it. There was nothing else, right? There was no mental health support within the school,
Right.
and that, that's how new I would say this is, because the very same school, I believe has a school counselor now, right? Or maybe even a couple, because it's a pretty big school. Um, but I think it's new, and I think in general I think it's been a welcome shift to our
Okay.
with Ireland and mental health and everything, right? Like, for example, I think the stereotype of Ireland is that we drink a lot of alcohol, people come here
Mm-hmm.
for a good time, and that's all true. That all has its merits, right?
Mm-hmm.
Among younger populations, so we're talking millennials and Gen Z, right? So probably like
Mm-hmm.
under 40-ish. I think alcohol sales are down like 35% or something like that with that population,
Yeah.
right? And people are just kind of deciding, of course, you can interpret that negatively, and you're thinking, well, are they social, right? Like, and that, oh my God, is this a social thing? And a lot of people interpret it positively, though, right? Like, because they're engaging in mental health, they're seeing what their parents maybe did and deciding that's not for them, right? Because it may have led to all sorts of different issues. So
Mm-hmm.
that's kind of been a big cultural shift that I have seen, where people are starting to prioritize walking together, getting out together. We have very cold beach, like seawater here, beaches, right? I live in a coastal town. People do the cold plunge thing for mental health benefits, right? Like, and different things like that. And healthy eating is bigger, but therapy is, hang on, I think did I lose? Okay, you're back. Sorry. What was I going to say? Therapy
Mm-hmm.
is a growing dimension in that too. A lot of people I know just have a therapist, and they openly talk about having a therapist the same way they have a doctor, right?
Right, right.
And so I think that's a welcome change. I like to see it. I think it's necessary.
Okay.
Um, I think the US still has a journey to go on mental health wise and everything too, right?
Yes.
Like, and I think the
Mm-hmm.
US in particular, like, has, I like, it's a very fast-paced society.
Mm-hmm.
It's a very work-oriented society, and that's great because of the amazing workers, and you can get great kind of output from that and all the rest of it. But sometimes I think I think being there, seeing it, and everything. Sometimes I think people should be encouraged to slow down a little bit more, look after themselves, and sometimes this gets neglected. That's what I found got neglected a lot in the U.S. at times too.
Right. Right.
You know,
Yeah.
and so and they're kind of the what's the term is the social determinants of health. I'm not sure if you've seen
Mm-hmm.
this. It's a new fad, kind of say fad. That's disrespectful. It's a new kind of measure of health and mental health in how we just study these things. And sometimes I found that some of the US towns that I'd visited and everything would probably not qualify very highly on the social determinants of health, right? People maybe aren't encouraged to walk anywhere. They
Mm-hmm.
drive everywhere. They're stuck in traffic. The commutes are really long for that reason. The US is a huge place, so
Right.
commutes can be long and different things like that. So and I think I see probably a lot of the same generational shifts in trying to figure this out, trying to figure out mental health. I see a lot of that in the US too, from people of all ages, to be honest with you. The people have
Yeah.
said, like, wow, my mental health maybe isn't as good as I thought it was. What do I
Mm-hmm.
do about it? And I think those are positive changes as well.
Yeah. There's still quite a few stigmas around mental health still in the US, right?
Yeah,
Not as many people as we would like to see come to therapy, or when, some people still feel like, okay, who wants to deal with the mental health? As if it's something disconnected from them, right?
right.
I hear friends, family members saying that, um, and oftentimes, again, I think it's educational, right? To help people understand that we're whole people, different parts, right? You can't separate mind from body, body from mind.
Nope.
And the same way we have a physical health, we have a mental health. And the same way we can get a cold and it needs treatment, sometimes mentally we can have something going on and it needs treatment. And
Absolutely.
right, and it doesn't say anything negative about you. And I think because the history behind mental health, this long history behind mental health has somewhat created stigmas. And so trying to help people understand that it's okay. It's okay to get the help that you need. If you're
Mm.
stressed and that stress gets too much, guess what? You have to learn how to manage it. And sometimes we're not taught how to do that. And so you may need to talk to a therapist or someone to help you manage it.
Yeah, and it's so interesting you mentioned the stigma, right? Like, I mean, even look at, if you grew up watching any kind of sitcom, US based or otherwise, there was always a therapist in there, and they were always a joke. Like, they were a joke. It was a nuisance for this person to go there, and the show would set up the therapist to look like an idiot, right? Like, and it was something that was not encouraged, right? Like, I always give out about this cliche. I'm not offended by it. I just think it's the same thing every time, where it's like, There's this person that goes in, they clearly need therapy, they're made to go to a therapist. The therapist asks, "Hey, how are you doing?" And then the person goes off on the therapist for asking a very simple question. And I'm sitting there thinking, what else is that therapist supposed to ask? Right?
Right.
What else are they supposed to do? But it is for so long been presented in this kind of almost like joke, quacky kind of manner. And that takes a long time to unravel. It really does, like you said. And age plays a role in that. I think kind of malleability plays a role in that, culture plays a role in that, like everything, you know what I mean? And I think if you're listening to this and you find yourself being the kind of first person in your family or one of the first people in your family to stand up and say, "I need to change
Mhm.
this," good for you,
Yeah.
right? Like that is brave because you have probably been faced with a bit of a headwind for so long around these kinds of things.
Yeah. Yeah. The one thing I'm glad for, though, is that while it's taking some time, there are some, positives around mental health. Like now, when you go to the doctor
Hmm.
asks you certain questions. Have you been feeling sad lately? Have you been feeling anxious? Because they're realizing the correlation between this mental health and physiological.
Yeah,
Because
100%.
if you're overly stressed, sometimes you can have pain in your body. We call that somatic symptoms, but doctors are aware that, look, sometimes we have people coming in here with these somatic symptoms that we cannot find biologically what's wrong with it. We cannot find the answer. And and that is confusing to people because they know they feel the pain. They know that they're
Sure.
tense here and they're having headaches and their back is hurting. But sometimes it's because of what you're dealing with psychologically. And it doesn't mean that, you're imagining this. You're feeling it. Of course you're feeling it. It just means that there is no physical proof to show that you're feeling it. So thus you have to talk to somebody to help you then process those emotions, the things that's causing you stress. So I see that there is a change even with doctors, because now when you go to doctors, they do pull out this form and nurse comes in and asks you, how have you been feeling this, lately? Have you been depressed, experiencing an anxiety? Because they're realizing that there is a correlation.
100%.
Yeah. But I want to ask you, like, how does mental health therapy differ from the U.S. In Ireland? How does that differ?
Yeah, I was wondering that when I moved over here because I was fully educated in the US. Like I went to high school here and then I lived abroad for, up between the age of 18 and 32, right? Like I just
Mhm.
turned 32 and I moved home. And it's been interesting, right? Because I read a couple of articles and I kind of prepped myself for it. And I find that practicing, I am less driven by diagnosis here. And
Mm,
there's people who really differ on that. Really smart people disagree with this, by the way, right? Like in terms of what to do about that and what they should do. I found so far that I am far more focused on symptoms than I am a diagnosis. And don't get me wrong, I have given the diagnosis here and
right,
there, but it's
right.
not actually too common that I would do that, right? Like, and I think for example, I worked in various different settings in the US, and it was a little more diagnosis driven.
Mm-hmm.
And it's hard to know what shaped what, but at least my understanding with this, if somebody thinks there's a separate cultural piece to this, please, I could be completely off base, but I found that the insurance companies in the US have a lot of power and they
Mm-hmm.
don't and they don't need to give you they don't need to um what's the word pay up if they don't think it's worth it, right?
Right.
Like, and they don't need to say cover the cost of your therapy sessions if they don't think it's worth it. And oftentimes what's not worth it to an insurance company is just somebody going and talking about their complex feelings
Mm-hmm.
and digesting things and changing how they think and all the rest of it. There might not be a diagnosis there sometimes, and they don't like that, right? Like, and so what ends up happening, I think sometimes, and what I felt happened quite a bit was I was almost kind of looking for a diagnosis for
Mm,
somebody to make sure, like if they had health insurance and I kind of knew what their situation was and it was like okay health insurance and it wasn't the best health insurance, whatever it is, right? I was very motivated. Like it was just on my mind more to
right,
ensure that there was a diagnosis because I
right,
was aware that this wouldn't, they may not come back to therapy if there wasn't anything. There
right.
wasn't a diagnosis because they couldn't afford it,
Mm,
right? And I'm just not having this. The insurance companies just don't have the same power here, just based on healthcare systems and all the rest of it, right? So they know that if they like, they know they're not needed as much, so they're willing to pay up a bit more.
right. I love that because I have sat down with many of therapists who feel like, okay, who does take insurance and often feel like they're pushed to diagnose, right? Like some people are just coming struggling with an adjustment, a life change, right? And but we have to show that it meets medical necessity, of course.
Sure.
And and so they and they get frustrated behind that because the person needs the therapy, right? But unless I diagnose them after the 6 months of adjustment disorder is over, this person, like, literally, okay.
I'm I'm glad you did the adjustment disorder thing too. I I remember a lot of people I worked with had adjustment disorders. A lot. So I'm glad it wasn't just me.
Yeah, because sometimes that's it. Like they're struggling with the life change, right? And often, I'm just glad that they lengthened this adjustment disorder.
Thank God, yeah, because it
Right.
used to be a couple months, right, or something like that, or
Six
was it even
months
less?
only. Yes, only
Jeez, yeah.
6 months. And then you have to change the diagnosis. Well, you
Mm,
have to, yeah. But now they've adjusted it, so that was lengthened sound right. The
the
reality is sometimes it takes people longer to get over these life changes.
yeah,
It takes people longer. 6 months sometimes isn't enough. But, in the US, okay, when you use insurance, you are forced to give a diagnosis. So I like that whole approach in Ireland. Like, you don't necessarily have to focus on diagnosis all the time. That's what I try to get people to understand when they come in and I say, okay, what you're using, insurance out of pocket. And I educate them on the difference, right?
yeah.
Because insurance is going to say, look, I need to show that it meets medical necessity, which
Hmm.
means I need to give a diagnosis,
Yeah,
even sometimes if you don't need one.
yeah,
Right? Literally. So I like that approach that in Ireland that you're not pushed to give a
not
diagnosis because it can be a lot on the therapist and the person as well,
right,
right?
right.
Because those are diagnoses that live with you, and nobody wants that, stamp on them for the rest of their life.
Yeah, and we all think about sometimes depending on the person, sometimes a person really relishes a diagnosis and they,
Mhm.
okay, this is what I have, this is what I have to deal with. And I feel good about this. I label my issues, whatever it is, and they can educate themselves on it. And it can be
Mhm.
incredibly validating. And sometimes for people, it's the worst thing you can do, right? Like
Yeah.
because that it really, and like therapists just have to use their judgment on that, use their experience on that to see what they think. Like, how agreeable is this person? How malleable is this person? How much of a
Right.
temper does this person have?
Right.
Whatever, right? Like, and you need to do you need to do what's best for the person in front of you, and sometimes
Mhm.
that differs depending on who that is.
I get it. I mean, there are platforms out here that therapists work in, and because people pay out of pocket, they don't have to. They're asked not to give the people a diagnosis. In reality, some people need a diagnosis because if you know what you're treating, you can treat it, right?
Yeah,
But not everybody needs a diagnosis.
yeah,
So it's one thing if you're aware that there is something going on with this person, and so this is how I'm going to have to approach it based on what I'm seeing, what I'm hearing. There is something going on, you can label that, just to be able to um, treat the person appropriately, right?
yeah, sure.
But I don't think it is necessary to always stamp it on somebody's, you
I
know,
agree.
records all the time,
I
because some of
agree.
this stuff is not long term. Depression is one of those things, it can be in and out. It's not a lifelong stamp, right?
Nope.
It isn't. Some people have it for a little while. That's why we have single diagnosis, reoccurring diagnosis.
Yeah, sure.
you know. So I like that approach in Ireland. I really do. And if we could adapt that in the US, it would be beautiful. But like you said, the insurance companies, they have a little bit more power here.
They do. They
Uh,
do.
and that can be the difficulty with therapists. I'm often realizing that therapists struggle with that as well. So, what are some of the things in Ireland that you see often from, diagnosis, mental health, without, breaching client confidentiality, of course. But what are some of the things that you often see, like people struggling with?
Yeah, I think it's interesting, right? Like I think some of the stuff that I touched on earlier, you have as well, right? Where you kind of have a new generation of people who are tackling, let's call it generational trauma. That's a lot I see of a lot, right? And unfortunately, I look, a limit to therapy is that I only meet with this person an hour a week. Sometimes it's less than that, right? An hour every 2 weeks, depending on the schedules and budget. Um, but I unfortunately see a lot of emotionally immature caregivers
Mm-hmm.
that young people have had to grow up with
Mm-hmm.
and deal with. And sometimes these people were raised in a situation where they didn't learn how to communicate their feelings. They turned to substances quite a bit. All these types of things.
Mm-hmm.
And then they had children and they just did not learn. They did not learn how to parent correctly. They did not learn how to communicate with their children when they got older. They didn't learn how to fight properly. They didn't learn how to disagree in a way. They didn't learn how to reconcile. They didn't learn how to make their child feel safe and secure, right? Those are two terms we use a lot in trauma work. And I see a lot of younger people coming, like some, in late teens into 20s, 30s, 40s even, right? Where they are really unraveling the damage of that.
Right.
Um, and it's hard to say, like, I can't sit here and just kind of say that's a cultural problem as such, right? It's just that those are the things that are in front of me a lot. And I kind of almost can see it as soon as someone walks in and they mention one or two things. I'm like, oh, this is another one of those, right? Like, and I know it's kind of like I have my pattern now. It's like that common, right? Like it's that common and it's that kind of, I'm that aware of it. And it can
Mhm.
be very uncomfortable and very distressing, but that's quite a bit of what I'm doing. Um, in terms of kind of anything else, I mean, like that's probably the main one. I think I think general issues that we see probably in the US sometimes as well, like cost of living crisis. You
Mhm.
know what I mean? Like this is a generation of people that are privileged to be able to buy a house, right? Like, and that's a tough one. It's expensive to buy your groceries now. It's expensive. It's much more, and wages have not necessarily risen to counteract that or to help that, and that costs.
Mhm.
And so people are not getting the same reinforcement that previous generations had from working really hard and
Mhm.
getting their money, building up their savings, and whatever it is, right? Like the building the perfect life. They have to go to other ways to do that.
Mhm.
They might have to look after themselves mental health wise, physical health wise, finding value in different things. And sometimes that's very difficult for people, right? Very
Right.
difficult for people
Right.
too. Now, is that an epidemic or something that I'm seeing kind of in front of me every day? No, but it's something that kind of does probably brush up in almost every patient, client, whatever you want to call it, of mine.
Right.
That needs some sort of addressing, some sort of validation or something from me to kind of help them through that because it's tough.
Okay. All right. Well, my daughter often says to me, Mom, I don't think it's a cultural thing. I think it's a human thing. She's like, as humans, we can learn so much from each
Absolutely.
other, but we have a lot, while we've made some growth, we still have a lot of growth to make,
Mm,
educating ourselves around, these behaviors and unfortunate traditional ways, styles, parentings, all of that. So she says it's a human thing.
100%. That's a great, yeah.
And I love that. What do you think both countries can learn from each other based on the systems and approaches? What can the U.S. and Ireland learn from each other?
I was thinking about this and quite a bit since being here. I think educationally, if you're
Mm-hmm.
looking at education and you're talking about in a mental health context, right? Like, so I think educationally, how we teach therapists to do to do what they do, I think both systems can offer a lot to each other. A lot of so it's kind of, to a little inside baseball over
Mm-hmm.
here. Like I said, this is a new field. It still kind of doesn't really like there is a governing body, but there's kind of several governing bodies, and they're kind of all trying to be a little legitimate, and they're trying to work
Mm-hmm.
together to establish a criteria to train therapists and all the rest of it. But there's still work to do. And
Mm-hmm.
these things are ever changing here, right? Like, and a lot of what they're trying to do is based on the US credentialing system, which
Okay.
is good. So Ireland is learning from the US. In terms of kind of if you're looking specifically at educating therapists, this is my original point. Um, I found I did my master's in clinical mental health counseling in the US, and I had to do hundreds of more hours
Mm-hmm.
practicing to
Mm-hmm.
pass to get through my master's
Mm-hmm.
than somebody would have to do here.
Right.
And I think I'm just such a believer in practical experience
Mm-hmm.
over theories and in books and things. And that stuff's really important. Like we need to learn like theoretical basis for what we're doing and the history of what we do and all the rest. That's all very important. But to be honest with you, like if I'm learning about behaviorism or something, right? I get more out of trying to apply behaviorism in a session than I do reading about Skinner and Pavlov and whatever, right? Like, and both are important, but I just think practical experience is the way to go there. And I
Right.
don't think people have to do as many practical hours here
Mm-hmm.
as they do in the US, right? So I just think that's amazing. The US system encourages that. One thing I noticed about here, just talking to other therapists, that wasn't the case in the US, and I don't know if this is university specific or if it's nationally,
Mm-hmm.
but in Ireland, you can't get a master's in psychotherapy or counseling unless you prove that you go to therapy yourself, and you have to get a therapist and to get sign off on that. And I don't know how many sessions it is, I can't remember, but it's a heavy amount, right?
Right.
And I'm pretty sure your institution pays for it as far as I know as well. And let's say, I don't know, it could be 10 sessions or something like that, and the therapist signs off at the end of the 10 sessions and says, yep, they completed that. And I think that's amazing because
Yeah.
we know, like, yeah, you might be somebody that is relatively well adjusted
Mm-hmm.
and understands themselves, understands the way they think, and is ready to be a therapist, but you don't know. I mean, you could be working with people that you completely disagree with in terms of
Yes.
how they live their life spiritually, religiously, what they've done in their life. You know what I mean? Like what has happened to you in your life. You might not be aware of any of this stuff, and it can
Yes.
affect you. And I think it's important probably to dive into this stuff before you start working with people. And
Yeah.
I just when I learned that this is what happens here, that I just thought that was really cool, and I think it should be probably practiced to a certain extent everywhere.
I totally agree with that. Can I be honest? I completely
Yeah,
agree with that. Unfortunately, it is not a requirement. I guess based on the university, I just remember when I studied my master's, my professor did suggest that we go to therapy, right?
mm,
Go sit down in front of a therapist. And that was one of our assignments. Go sit down in front of a therapist so that you can experience what the client is experiencing. Going and sitting in front of a stranger and talking about, your life.
mm,
And it was quite eye opening because, again, we're human
right.
and we all have our experiences and we all have our views on the world and people and all of that. And just sitting in front of a therapist, and dealing with those things are key. Because we don't have that, unfortunately, because we don't have that, a lot of people are struggling with therapists who are judgmental because of race, gender,
Yeah.
sexuality, all of that. And in this field, you have to leave that judgment, at the door, right? Because it's not about you, it's about the client. And that's how you have to live as a therapist when you're in those sessions. This is not about me, this is about the person sitting in front of me.
And people might think that only goes sort of as far as, obviously somebody who has a different spiritual beliefs or religious beliefs to you, you can't enforce them on or enforce that on someone. Or if you grew up in a different part of the United States or a different country or a different part of the world or whatever it is. People are kind of shocked to the extent that that goes. And I don't think every therapist in training is ready for that, to be honest with you.
Right.
Like I've seen this before where if I had worked with an intern or something in a previous job, their client might come to them and say, I cheated on my partner. And that intern is kind of like, what do I do? And I'm sitting there going, that's because that's something that we can immediately empathize with and say, I would hate that. That would wreck me. But I'm their therapist. Right? I am open-minded. I am willing. I am in their corner.
Right.
Here. And I am working with them, and I'm just going to focus on why. Like, why did this happen? And how did this happen? And how do you feel about it? And all the rest of these things, and give them validation. Like that's how in their corner we have to be, and it's unless someone is in danger, right? Then we have to break that. And that's about it. That is about it,
Shane, I'm like hopefully the US can adapt that concept, right? Because I would have loved it if the university would have paid for 10 sessions for me. Can I just be honest?
Yeah.
I would have loved that. But I had to pay for my own sessions.
Yeah.
But I learned a lot from it. And of course, in learning a lot from it, from both standpoints, because I had to go through two different therapists. The first one was judgmental. Quite judgmental, based on this racial idea, because the first one was a European American, and she was more concerned about if all my mother's children had the same father.
Wow.
Yeah. Okay. And so that kind of knocked me out. And I talked about that with another therapist who was also European American, and she was disgusted by it. And that tells you that everybody has these different perceptions, right? But we do bring our worldviews everywhere we go, but you have to learn how to leave it at the door as a therapist, right?
100%.
And so then I had to go and find an African-American therapist because I was safer feeling, after that, I just felt safer doing so. But I think if we were to have something like that in the US and make people, because I remember taking a class and they made us look at our own biases. We have to be honest about our own biases around race, gender, sexuality, all of those things, because we all have them. And being honest with yourself about those biases, but also understanding that those biases, you cannot take into therapy with you.
Absolutely not.
Right. Because that could totally harm the therapeutic relationship, right? And making sure you understand, too, that this is not about you. When these people come and sit in front of you, they're working on their life, their stuff. They can't do that if you're jumping into their world with them, trying, right? You
100%.
can make it about you. So I love that concept. And maybe, hopefully, one day the U.S. can pick that concept up, really. Because I definitely love that. Okay. So my question to you now is, what practices do you feel like would help individuals process trauma regardless of their background?
This is tough, right? Because I think it's tough because this is very difficult for people to do, right? Like it is very difficult for people to do. And I think if I could boil it down to just kind of, work with a therapist, talk to someone, and understand why you think the way you do. I think I said that earlier, right? Like to understand why you think the way you do. And hopefully the therapist will work with you and not a, to tie in our previous conversation, a preconceived idea of what the therapist thinks you
Right.
are.
Right.
Therapist hopefully works with you and finds a specific way of treating this specific way you perceive yourself or perceive the world or whatever it is that is self-destructive. Okay. This might be mindfulness practices, right? This might be you learning how to quiet, to silence the hurricane that's going inside your brain. It might be because of mindfulness. It might be or it might be you're encouraged to do mindfulness practices. It
Mhm.
might be meditative practices. You might need something really active. You might need the therapist to work with you on developing some sort of a plan for like exercising or being moving more, different things like that, socializing more, right? These are obviously lifestyle changes, but mindfulness, meditative exercises, like I said, understanding the way you think, that can be really helpful. Like CBT can be very helpful with that. Cognitive behavioral therapy, cognitive restructuring,
Mhm.
understanding what, like, you as the patient, let's say, are perceiving something in automatically a negative way, and you
Mhm.
don't even realize it.
Mhm.
And you might need to learn how to positively self-talk or something like that with the therapist. It really depends on the person and the
Right.
issue at hand here,
Right.
right? But it starts with going to a therapist, right? Like I've had I had a case a while ago where it was, person had been to therapy, didn't have the best experiences with it, really awful kind of just physiological anxiety, right? Like a nerve, to quote our just wait till you kind of come back here. Yep, there you go back.
Okay.
To quote our earlier conversation, someone's amygdala is just firing too much,
Right.
right? And we had to learn how to quieten that, lessen that. Like week by week, we'll lessen that through meditation.
Mhm.
And then what we had to tackle was the result of said kind of amygdala attack, which was obsessive kind of thinking, obsessive tendencies, compulsive behaviors. How do we manage those things, right? So it was kind of like a two-pronged attack, really, that we had to
Mhm.
work on. But that takes a lot of kind of dissecting and understanding why you think the way you do, and then go from there, right? But it can really depend. It could be cognitive strategies, it could be meditative strategies, it could just be literally talking and figuring things out and just understanding the way you perceive the world too.
Right. I love that. I love that because it's making sure that you understand that it's not a one fit for all.
Hmm.
Right. EMDR is a big thing now, internal family systems, and I love them
Yeah,
all, but they don't work for everybody.
not
Right.
everybody,
Most people go, do you do EMDR? Right. And I'm training in that area. I use EMDR in
I
forms.
want to as well. Yeah, it's amazing. Mm,
But I realize that it's not for everybody.
no,
It really isn't. And so there is not a one fit for all. It's about therapists understanding the client that's sitting in front of them, and then pulling from those, bunches of interventions, modalities, and see what fits that client. And sometimes it is meditation, mindfulness, okay, CBT, helping them with, re-evaluating how they speak to themselves. So I love that. My last question to you, because we only have a little bit more time left, is what message would you leave for that person that's listening? From either side of the US
mm,
or Ireland, okay, who's
mhm.
struggling in silence, what would be that message that you would leave with them?
You know how to walk, bike, or perhaps drive a car or anything. Use those modes of transportation to go to a therapist, even just one time. Okay. It's overwhelming and it's terrifying for some people because confronting these things can be horrific and it can be really scary and people don't want to do it. And I understand why. It's natural for us to just seek comfort, right? Like to seek what's comfortable and familiar to us. And this is very scary in the unknown. My advice would be to just go at least just to one session. You don't need to know everything. Most of the people that show up in my practice don't even know where to begin. And I just kind of say to them, just talk. Like, how's your day going? And we go from there. You'd be surprised, even if you just tell me that hate the weather or something. The weather sucks, which happens in Ireland, right? Rains a lot. So like it's the great place to start, right? Like, and people go from, you'd be surprised after an hour what will be said and how you feel about it and how less scary it becomes.
Right.
At the very end of the session, I promise you, I would promise you, you will know even 0.5% more about what you need to do to get better. Even if that is literally like, I need a different therapist, which is your case, right? Like you're like, I need to get away from this like judgmental person, right? Like, or I need to come back to this therapist. This therapist knows me, I feel safe, and this person seems to know what they're doing. That's what I will promise you. That and even if you know that, you are already further along this journey to making yourself better. And that's a great place to be.
I love that. I love that. Thank you so much, Shane, for having this conversation with me.
Thank you.
I enjoyed it. I want to welcome you back, though. I got to have you come back. I talked to you about that before. Got to have you coming back because I really want to get your input on men's mental health. But I thank you for being here with me today. I thank you for your input.
Thank you, Bertha.
And thank you, too, for watching. And until I see you again, I want you to always remember to talk about mental health and how to make yours a priority. Have a great day. If you are a professional or someone with a story and would like to be a guest on the show, go to our website, intaketalkshow.com, and complete the form to be a guest. Perhaps you are someone with a question or comment that you would like addressed on the show. Again, go to our website, intaketalkshow.com, and complete the contact form. I hope to see you soon. And remember to continue to talk about mental health and how to make yours a priority.
This concludes our conversation with Shane Quinn. Did you enjoy this topic? We'd love to hear from you. Don't forget to follow us on your favorite podcast platforms. And please like and subscribe on our Facebook and YouTube channel. Join us next week for another great conversation on mental health.